Hi, this is Irma Jennings, health coach and osteoporosis patient navigator. Kindly do me a favor. Subscribe to my YouTube channel. This way, the information will get out and circulate to more people, and that's important. Like the this YouTube with a thumbs up and comment. All these things will help circulate this information so more and more people can hear it. Thank you so much for your efforts. Hi, everybody. This is Irma Jennings, and I am your friendly osteoporosis patient navigator. And I am really happy that people have joined our call tonight because bones, balance, the pelvic floor, it's all a very, very important part of our body that often is not talked about in public, um, and not talked about amongst our friends, so to speak. So I met Molly. There was a menopause panel that was done locally, and she showed up. As you see, she has a little her tattoo on her chest, which is right away I was like, oh, I like this chick. And she had silver boots on. And she spoke from a place of not only knowing, but of sort of a stronger feminine quality that I was really quite attracted to because sometimes we get a little shy around certain things. And I found that Molly was like right on. So I'm happy, really happy that she's here. Molly's going to say a little bit about herself. She's a doctor, she's a physical therapist. So tell us a little bit more about you, Molly.
That's such a nice introduction. I really appreciate it. So yes, my name is Dr. Molly Weingart. As you heard earlier, I live in Hopewell, New Jersey with my boyfriend and our two dogs and the dogs really want to help with the presentation. So I apologize if they bark again. But I'm a physical therapist. I practice at a place called Active Core Pelvic Health Physical Therapy. We're in Princeton, New Jersey, and I specialize in pelvic health and lymphatics. I'd also argue, people, I think pelvic health, as it gets to be more of a term that people are starting to get to be familiar with, sometimes gets limited to this idea of like, oh, you work with women who just had a baby and they're peeing, and like, yes, but pelvic health really means everything that we has to do with the pelvis. And so, yes, I'm a physical therapist. I love to do things outside. Love being with my dogs. I'm very active. I'm a total book nerd. And anything I can do with my hands. So a lot of embroidery and knitting and things like that. I grew up in Surgeonsville, New Jersey. So for you Lawrenceville, Westfield folks, you might know where that is. But in terms of this presentation, I have fairly serious looking slides. Don't be intimidated by them. They're just information. And what I'd love to do is kind of give you all a sense of like, kind of what is the pelvic floor? What does it do? What do we mean by that? And then some ways of like, what are some kind of common areas of dysfunction when we think about what's going on with the pelvic floor? And sort of think of, are there quick strategies we can come up with, but really just foster a conversation. When I go to a cocktail party or people say, what do? I say, I talk about pooping, peeing, having sex, and swelling all day long. So really, like, I invite you to ask questions. I always say nothing shocks me. I think the only thing that I really hate is public nail clipping. But otherwise, like, fair game. If there's something that you don't feel comfortable asking in the group chat, you can either send a private message to Irma or myself, or you can email me after. That's fine. Because, we all have our comfort zone. So that being said, does anybody have questions before I get started?
We are going to do some focusing in on the pelvic floor and how that relates to balance as far as fall prevention and osteoporosis and things of that nature. We're going to talk about that. Yep.
Cool. All right. So without
I
further,
I do have a question.
ooh, yeah, good. Go for it.
Okay, so I had seen a part of a webinar of somebody else doing pelvic floor stuff, and she said, "Don't do the Kegels. That we're supposed to do the opposite and kind of just
Um,
like."
it
And
depends.
then other people say Kegel strength.
Yeah, it depends on who you are, and what you need. And so what a Kegel is, interestingly enough, it's a contraction of your pelvic floor. The action of contracting your pelvic floor consciously, it was found by a woman, I need to remember her name, but somehow she didn't get credit. And a German guy whose last name is Kegel gets credit for it. Just so you know, little background. But what that is it's a full contraction and relaxation of your pelvic floor. I'll explain what that is in a second. And so when you're thinking about a contract, relax motion, it's thinking who needs to be able to lift, right? Like, so if you were someone where you had a lot of trouble making a bicep muscle, right? You would need to do bicep curls, and you would need to be able to go through this motion and all the way to this motion and all the way through that motion, right? And so with Kegels, sometimes it's like, if that's what if your muscles are weak, that is what you can benefit from doing. In general, I find people who haven't seen a pelvic floor PT are doing Kegels incorrectly. And so I find that often my feeling is like, have somebody check internally to see if you're doing it right. And also, it's like, is that something you need? And I'll explain kind of why that might be something you may or may not need. I think it'll make a little bit more sense when you see some anatomy. But yeah, that's a great question. And it's a very popular question kind of in the sort of professional dialogue of the pelvic floor community for sure.
Okay. So thank you. Thank you for that. So we'll go right into the presentation. So you're up, Molly.
All right. So here we go. So little pelvic floor physical therapy. This is my bio. You can see what I looked like before I had bangs. All right. So here we go. So this is our anatomy of the pelvic floor. And what I really like to think about is this is a two-dimensional and a three-dimensional way of thinking about muscles. The pelvic floor itself, I'm sorry, I left my pelvis in my office, but when you're looking at your pelvis, you can put your own hands on your hips. You can feel your pointy hip bones, right? And that's your pelvis, right? Inside that pelvis is a layer of muscle that's layering the pelvic floor. It's 3 layers of muscle and a layer of connective tissue. And when I think about what connective tissue is, I think of it kind of as like if our bones and our organs and our muscles are the bricks of our house, connective tissue is one of the things that makes up the mortar. And so the pelvic floor, it's this layered system of muscle, and it needs to be able to contract fully, right? It needs to be able to relax, but it also needs to be able to elongate. And that's where we get into some of that dialogue about, are we doing a Kegel fully contracting? Are we doing the opposite of a Kegel? Kind of, what is it? Because we need to do all of those motions. I think an image that I like to think about a lot with it is a hammock. Also, I just moved to Hopewell, and so and I have a porch and a deck. So I have porch furniture for the first time since I was a teenager. I'm 40, by the way. So it's very exciting for me. But so I've been thinking a lot about yard stuff, and so I've been thinking about hammocks. And the pelvic floor really is kind of like a hammock. A lot of the muscles attach both. You can see on this muscle attaches right here at your pubic bone, right? But you can also see those little wavy lines, and they're going all the way back. This is where your vagina is, and they're going right back into between the vagina and the anus. So, and then those muscles are also, then we're going right from there, we're looping back all the way to the tailbone. So you can kind of see that these muscles, they are forming a hammock. And you know from setting up your own yards that if your hammock is too tight, you are going to sit down in your hammock and you're going to bounce off onto the ground, say. And if your hammock is too loose, you're going to bounce down onto the ground and hit your butt and it hurts. But if your hammock is just right, the hammock can accommodate your changes in pressure and accommodate the load, and you can just swing and read and hang out in the sun. Does that kind of make sense a little bit?
Mm-hmm. Yeah.
So the other thing, and I kind of alluded to this a little bit, is that we have this pelvic floor that, when I was in PT school, they're like, okay, so you just talk about peeing and pooping, but there are 36 muscles that are attaching to this one little bone, or not one little bone, 3 bones make up the pelvis, right? But this one area of the body. So I think in pelvic I think everything, I'm always like, it's all pelvic floor, it's all your lymphatics, but that's just my biased opinion. When you're thinking, but in terms of the pelvic floor, it does have sort of 5 main buckets of function. And that again is kind of based on the anatomy that we have. And so this image, to kind of orient you, is basically what I would see as a clinician when I'm looking at someone laying down, where here is the mons pubis, pubic symphysis. Here is the head of the clitoris. Here's the urethra. Here's the vaginal canal. Here's the anus, right? And then this image would be sort of removing all the organs and all the skin, so you're looking down, okay? So one of the functions of the pelvic floor is some of the functions associated with sex. I love talking about sex. I'm also a sexual health coach. You can ask me any questions you want. Please ask me questions. But you know that, yes, the clitoris is one of the major structures associated with sexual activity for people with a vagina. And I think everybody, I don't know, I haven't looked at everybody in the call, but and then same penis, right? So, but I kind of think that if that's like our only area of sex, that we're thinking of only penis and vagina, that's like we're going to a buffet and we're like, this is an all-you-can-eat buffet and we're just going to have breadsticks. So just sexual function, one of its things, not the only way to talk about sexual function. It also has sphincteric functions. So that's where we're thinking about letting things out and keeping things in as we choose. So that's where we're thinking about taking, peeing, pooping, babies, toys, whatever we're putting in, whatever we're getting out, right? The other one is stability, and then a one closely related to that is support. And that's where we start to get really interesting with balance and fall prevention, right? So your pelvic floor is in the center of your body. It's the thing that is like, it is supporting all of the organs. It's supporting your spine. Everything above it is the pelvic floor is holding it upright. And also, in terms of a stability perspective, there's, if you look at studies of looking at muscle firing, if we go to fall, the pelvic floor will volitionally fire to some degree to help us stabilize. It's actually kind of how I found my own pelvic floor. Was I really like to do handstands against the wall. And at some point, this is before I was in PT school, and I'm a second career PT. So this is like, I was like 28. I was doing a handstand against the wall, and I was like, if I squeeze this one part of my body, I feel like I can hang out in this handstand a little bit longer. And that's because we're getting that balance from that muscular stability. Another component of pelvic floor function is circulation / lymphatic system function. And that's because like the lymph nodes that you have in your neck, you have a lymphatic system with nodes like this and vessels like this all throughout the body. And that the largest concentration of those are both here at the neck and then in the lower abdomen, kind of around the sort of last couple vertebrae of your lumbar spine, or like right around your belly button. And that's important because if you're feeling like you're getting some abdominal swelling, or we have a C-section, or we have a hysterectomy and there's some scarring, and all of a sudden people are like, I'm really bloated, I don't know why. That's where that lymphatic system is saying like, hey, I need some help. I need you to help move this fluid through my body. Another way of thinking about that too is if there's any cardiovascular insufficiency, that's where again circulation is impaired. And one of the places that we can sort of think about improving that circulation are those little lymphatic vessels in that area of the body. Everybody with me so far?
Wow. That's all I can say is had no idea. Before we move on, when
Yes.
people crack their pelvic, is it pelvic or pelvis when they break?
The bone?
Yeah, what is it,
Oh,
pelvis?
yeah.
So where do they typically fracture that? Because that happens a lot in my community.
Okay, that is an excellent question. And that was one of those things that when I was in PT school, I was like, well, you said it was a hip fracture. Like, what's
Right.
going on? So common places that we see fractures, and this is where there's a fracture. Actually, this is in the femur, thigh bone. And this is the head of the femur and the neck of the femur.
Mhm.
This is a fracture that can be difficult to heal in that this area of the body doesn't get a ton of blood flow to it,
Right.
or this bony prominence itself. In terms of hip fracture itself, it depends on where someone falls. and like what part, you know, where, like what direction we're going to fall in. Um, I, so I'm trying to think of the, like where I've seen hip fracture, the recent hip fractures I've seen. I actually have somebody who has a pelvic fracture she's about to finish her treatment. She's doing great. When I see a pelvic fracture itself, usually it's more along the sacrum, this bone here,
Okay.
right in this region. This would be the back. But yeah, but hip fracture itself, the hip joint is made up of the pelvis and the femur. So usually it's kind of in there.
Right, but sometimes it's in the pelvis itself, right? On the backside, as you were pointing out, or
Yeah,
no?
I mean, pelvic, any bone in the body can break. So the pelvis itself actually is three bones
Okay.
that are making up um this sort of, it's actually like a cartilaginous joint. It's a joint that's really held together by force and by the bony sort of interlocking of it.
Mhm.
If you can have, sometimes with childbirth, this here is cartilage, is blue. Sometimes somebody can have what's called a pubic symphysis diastasis, which is where during childbirth, often, I mean, it can also happen with a severe fall, that can separate, and it can be very painful, recoverable. I've had clients have it, do well, they're great by the end. But so this is a place that I've seen a fair amount of fractures. But it is when we're thinking about a fall and we're thinking about a pelvic fracture, we're thinking about what is the part of your body that's absorbed the most impact, right? So if you're going to fall on your side, this part right up through here is where we're going to see a little bit of that fracturing. Is that
Yep.
answer your
Yep.
question?
Yep. And we just had somebody made a comment that she fractured her actual pelvic bone in the front and the back while she was during skiing. I
Oh
guess.
no. How are you feeling now?
How are you feeling now, Carrie? If you can write that in the chat. Um, and while Carrie is writing in the chat, Anne Marie missed the part. What is bloated? You had said that there's a lymphatic area in your belly,
So
right?
bloating or swelling, or, I mean, have you ever had that kind of feeling where you're like, oh, mom, I can't go to school today? Or your kids have done that with you where they're like, feel my lymph nodes. They feel really puffy right through here.
Hmm.
That is lymphatic swelling. That's edema. Um,
Hmm.
Even, sometimes people are like, oh, I had a lot of salt. You gotta loosen my belt a little bit. Like kind of that sort of just feeling not like we've gained weight, but like things are kind of puffy and things just, that's sort of where, and I think sometimes when I mentioned hysterectomy and that sort of bloating, I've found that we start thinking about lymphatic drainage and lymphatics health sort of secondary. Like a client will come in and they'll be like, okay, I'm here for a hysterectomy. I've been having some pain at my scar site. And also like I've gained like 10 pounds since my surgery. Like I would love to do something about that, but I know I'm here for the scar. And like, but then it's like that kind of, and you're like, well, have you changed your diet? And they're like, no, it's just kind of there. No matter what I do, I just feel like kind of round. So it's kind of that sort of, people sometimes call it water retention. It isn't necessarily just water, but
So it could be the lymphatic, what you're
yeah. And
saying.
lymph fluid itself is made up of proteins, fatty acids, water, cellular debris. So it's just, it's some body goo, I guess would be a official.
Body food. So that's the official term.
Mhm.
And that the lymphatic drainage, the lymphatic system is a whole nother conversation. It's a
Oh my
big
God.
conversation.
We could do a whole presentation. We could do a whole presentation about the lymphatic system. It's so
Now,
cool.
Carrie is feeling great after a year of Timlos injections and HRT. That was Carrie who fractured her bone.
Okay, good. I'm
Oh,
glad.
yeah. Okay, let's go.
Okay. So all right. So this is gonna branch out. So I put my little hammock in there. I mean, not my hammock. I would love to have a hammock like that. But this is sort of, we're starting to think about what I mean of why that hammock is gonna be, how are we gonna know that we're sitting in the hammock and what it's gonna do to help us. So the pelvic floor is also, it's not just operating in isolation. I think again, going back to that idea of Kegels, it's never am I giving a client, actually very, very, very rarely am I just giving someone a Kegel to do. What we're also thinking about is, how is this pelvic floor part of a system of movement? And I always like to think of it as like a core canister, that when you're thinking about your torso here, ding, 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 that this, your pelvic floor is right here at like the base of this. And that your pelvic floor is working in very close relationship with your abdominal muscles, your back muscles through here, and then the diaphragm up here, which is a dome. This is by far, I mean, I could talk about the diaphragm for all day. I have a whole slide about it later. But these muscles, these body systems, this tissue, that when you inhale, actually, you're taking in air. We take in air, there's more pressure on a system because there's more stuff in it. Just like you can blow up a balloon. If you were in my office, I could give you a glove and we could practice blowing into the glove and like seeing how that gets bigger. But we're increasing pressure, right? There's more stuff pushing. So the ideally, the abdominal wall should press outward. The back, even, I like to think of the back also going outwards. Even we're going out side to side, pelvic floor is going to lengthen a little bit. This all should happen on an inhale. On an exhale, your pelvic floor is going to contract, your abdominal wall, your back muscles are going to come back together, your diaphragm is going to come back up to its position, air is going to come out. Because and so, but that, I don't know anybody who breathes correctly. Like, we're all running around. If our posture is a little bit slouched and you go to take a breath in, your abdominal wall is contracted, so you can't really fill in to that abdomen. You can try it. Kind of bend over in your chairs now. And try to take a breath in while you're slouched over through your nose. And then exhale out your mouth in that slouched position, right? But now sit up nice and tall and take a breath in through your nose, sitting up nice and tall, and a breath out through your mouth. So ideally, so you can see like how that changes where the air goes, how much air you can get into your body from there, right? And so the pelvic floor, part of what it's doing is it's trying to help us maintain that pressure and respond to pressure, right? There's more pressure on the body when we go to stand up than when we're laying down, and we are fighting a losing battle against gravity all the time. So that's where we're thinking about losing control of bladder. That's where we're thinking about stooping forward and balance, right? That we want as much bony stability, right? I like everything should be as lazy as possible so we can get a nice stacked posture, but then also how we can get these muscles to help just interact with kind of I always think, like George Washington and the apple, like how we can like sort of think of like, okay, well, you know what, we're going to cut this down. We're not going to cut that down, right? Makes sense a little bit. So what gets to be interesting, I mean, I think it's all interesting, but when we're thinking about this pressure management, in that if something we want to make sure, like what happens if by excess pressure is this question that I pose right here. That's like, say, a sneeze, because a sneeze is a forced exhale out of the body, right? And that's where a lot of times somebody says like, you know what? I pee when I sneeze. I pee when I laugh. I pee when I cough, because we're putting so much more load on these muscles with just what we're doing with air, and it's involuntary, which is why that's one of the places that we see a loss of bladder control. Again, not necessarily a question of do we need to do Kegels or not yet. We'll get there, I promise.
Okay.
And then when you think about what's having that inadequate pelvic floor support, right? This is a big one in terms of what happens in terms of menopause, of hormonal changes to tissue. Again, we'll get there, foreshadowing. Any questions so far on this situation?
None that came in.
Okay, everybody having a blast. Okay, so the other way to think about this in terms of thinking about this as a system, and this is again thinking of like, well, you know what, I tripped when I was walking and that's why I fell. I don't understand why you want me to talk about like these tiny little muscles in my pelvis. It's the body is, I like looking at the body. This is the work of someone named Thomas Myers, where we're thinking about the body as moving through a system of chains, called myofascial chains. And it's that you're thinking, again, kind of going back to that brick and mortar concept, that we have, you know, your bones are your bricks and your muscles. And then you have these chains of tissue that are going from, this is the superficial frontal line, but it's going from your ears all the way down to your feet. And then we've got, you know, we have a spiral line where we're coming up outside of the hips and we're crisscrossing across the body. And, you know, we can go on and on about how these look. This one is the deep ventral line. This is where we've got a lot of pelvic floor function. So you can see, check this out, neck and pelvic floor, very related. So again, we're thinking about if we've got, and the way that these function, in that there's this, in our architecture, there's a concept called tensegrity. And there's also some really interesting conversation around something called biotensegrity, which is really just compression and tension. And so when you're thinking about, you know, myofascial chains, if something starts getting funky along one of these chains, we have to think what's going to change above, below, around, next to it. Okay. And so it's kind of like we get a knot in the hair. So it's not that it's not your hair. It's not that you've lost your hair. It just looks a little different than it did otherwise. I have curly hair and I live in central New Jersey, and you can practically chew on the air. It's so humid here, hence the curls, but it's not knotty. I promised, I brushed it. But so if you've got this, that, like, say we've got that stooped forward head posture, let's say, oh my God, my neck starts hurting. My neck's hurting, and, you know, I'm having some pain with penetrative intercourse. But then I move my head into a different position. That's weird. That felt different, because these things are all connected. Make sense?
Yeah.
Cool. Exciting. Okay. Yeah. And again, thinking about this all as a system, right? Because I like to think about how all of these pieces, what are all the players in this game? And then how can we put each of those players in the right positions so that we're having like a winning team, right? And so and the other thing that, you know, this area of the body, right? Like, I don't know how many of you have spent a ton of time like being like, I wonder what my labia minora on the right is doing today. Like, I don't know. Maybe you spend a lot of time thinking about it. Most people don't. It's not an area of the body that we really spend a lot of time getting to know, not that we're encouraged to explore, both in a sexual function, in just a health function. I find most of my job is just teaching, like, what's happening with your body. And so sometimes if we're trying to treat this part of the body, you're like, you know, people are like, I don't know where it is. I don't know what you want me to do. I can't feel anything. One of the ways that we can get there is say, okay, well, what else is working with this that we do know? And how do we start hanging out with that part of the body to help what's not working? So that's where our friend, the diaphragm, comes in. And seriously, my favorite muscle in the body. It's so stinking cool. Because what the diaphragm does is that when you breathe in, the diaphragm is kind of the major player that's going to flatten and expand 360 degrees to start that. I mean, I think about it as stretching from the inside out. And, you know, and the diaphragm also just interacts with so many different body systems. So it's like breathing is something that's really special, because it's something that we're doing automatically. We're not thinking about it, but it's also something that we can do incredibly consciously, right? Like, you can think about free divers who are practicing drills to hold their breath for minutes at a time. And that when we start to bring that conscious breath, or even the unconscious breath, it plays into every single system in our body. So given that we can do things with breathing voluntarily, we then have control over our heart, some control, heart function, the lymphatic system, musculoskeletal, and your nervous system, right? And so it just gets to be very interesting. So diaphragm deserves lots of love. And so now I've kind of gotten you to, we have a little bit of anatomy, we have a little bit of function, and now we can start thinking of what is it, kind of what does pelvic floor PT look like? But then also like, what are things that we can sort of think of immediately to think about health, right? And a lot of what I think of is like, with traditional PT people, or a lot of times people come in and they're like, okay, I want you to give me an exercise and you'll do the manually things you do in your office. And then I'm going to go home and I'm going to be all fine. And it's just, we need, very rarely can you make a good change in your body's function without thinking about what are the behaviors that are going into that. What are we doing with our lives, right? Like in terms of, again, if you go back, so one of the things about our diaphragm is some of its nerve, one of the nerves that innervates it is called the vagal nerve. Vagal nerve's pretty trendy right now. I feel like you're all in your social media going to get inundated with vagal nerve stuff thanks to this presentation after it. But the vagal nerve really is one of the nerves that's responsible for your the kind of rest and digest part of your nervous system. And our bodies can't heal if we're always in like an upregulated state, like a really anxious state. One of the examples of this, if you're not sleeping, no one's going to feel good. And then the nervous system isn't going to have time to heal. I find a lot of times I have a lot of clients who get up a lot during the night to urinate, or they wake up kind of concerned about things that are happening in their lives. And that puts you, sleep is a major fall risk. And it's also, it's good for cognitive function that we make sure we're sleeping. So a lot of times thinking of like, what does your sleep routine look like? In terms of bowel health, depending on medications, nutrition, if you're constipated or you're, starting to think of like, okay, what if I go to the bathroom I'm going to set it my poop time for the time of day where like 9 a.m. I've gotten up, I've had my coffee, you're going to go into the bathroom and you're going to sit for 5 to 10 minutes, see what happens. Do you have a bowel movement? Do you not? If you do, great. But like bowels love routine. They're very sensitive. And I think, so these are kind of just some examples of things that I think are really important to think about when we're thinking about just to not get wrapped up in like, what are the exercises? What is the muscle function? Like, what are just the things that we can do, without, just kind of in our daily lives. Any questions on that?
Yes.
Yeah.
I have a question. What if you have a large hiatal hernia and diaphragm isn't working the way other people's diaphragms are working?
Exactly. Yeah, that's a really good question. And so when you've got a hiatal hernia, first and foremost, like, you follow any precautions or anything from your healthcare provider. But when you're thinking about that hiatal hernia, you're thinking of like, okay, how is that impacting your core stability, right?
Right.
But with a hiatal hernia, one of the nicest gifts you can give your body is working on your breathing. And so when we're thinking about, so like your diaphragm isn't functioning the way it might if you didn't have the hernia, but there's still all the parts of the diaphragm that are attached to the back of your rib cage, the sides, right? Like, because your diaphragm's 360 degrees. And so by giving yourself that breathing in and out and giving yourself a little bit of the mobility, like, because what's interesting, the rib cage is very mobile. Like, it's not just this solid bird cage like object that we have in the body, and the diaphragm lives inside the rib cage. And so when we're breathing, the goal is that those ribs can move a little bit and the diaphragm moves a little bit. And if it's stuck, we're not getting any of that movement through the rib cage. When you have a hernia, so let's say this is sort of the front of your abdomen and you've got a little bit of this gapping, right, in that hiatal, and you've got this little gap, this little hernia, that is where, like, if you go, you want to be able to breathe well so that you're not putting more pressure on your system, right? So that you can take a nice breath in through your nose, and it doesn't have to be like filling everything up, but that you can still practice just giving yourself mobility. Like you don't have to be afraid to breathe. Does that answer your question?
I'm not sure yet. I'm going to have to think about it because I think I have a large hiatal hernia. I've had it for years. And
Yeah.
it's my understanding that it begins the part that goes into your upper breathing category, into your lung area, actually gets attached to those structures. And that I think that has some, ability, some cause to make it difficult to do what you're suggesting.
Oh yeah, it definitely makes it. It does. I mean, if you were my client, I would do a lot of exercises with you around quiet breathing and just mobility
I've been
through.
working on my breathing. I agree with you. Yeah.
And even just gentle, because again, we're thinking about bone health, gentle manual therapy to just the areas in between your rib cage, right? Of like making sure those intercostal muscles can have as much chance at moving as they can. And really giving yourself, thinking about even, thinking of when you're thinking about your breathing, kind of going into a place of, I like to shut my eyes and picture all the places, like all the muscle fibers, all the bones, and think like that you're going to breathe into them.
Yes.
And that what I think about is like our muscle fibers they're fibers. They run in different
Right.
lines, and picture almost inflating those lines just a little bit and lengthening them.
Okay.
I feel like when you're trying to, because breathing is so hard. I mean, I have a client, this was my third visit with her today, and we did, I think I gave her, I think it was like her third specific breathing exercise. I mean, she's doing great. Like, she just had a baby but
So
yeah,
as it relates to pelvic strength,
yeah.
those you have to do it like in a sequence, and before you have to do the breathing, conquer the breathing first before you can address the
Kind of
pelvic.
depends on who you are, honestly. Like, because some people, they're like, I know exactly where my pelvic floor is. Like, I got this, right?
Okay.
Um, and so it's kind of because this is working as a system. And so I don't know what you were like in school. I'm sure you're shocked, was a giant nerd. I'm talking giant nerd. And I got really good grades. And when it came time to a group project, obviously someone does more work than the other one.
Right.
And that person who's doing more work eventually is like, F you, I'm out. I'm done. I can't do this. And that's where we think about injury, right? So it's like that's where it's like we've got that back,
I
abdomen,
understand. Yes.
so it's kind of like, okay, so, but then for you, we can flip that on its head. Like when you're thinking about the hiatal hernia, okay, so you know what, how can we really help your back support you? How can we make sure that your back is strong? How can we make sure your posture is really nice and stacked?
Yes.
How do we make sure your glutes are strong? Like that kind of, it is a group project. So we have the cause of the injury, but then if we work as a team, everybody, maybe somebody needs a little bit more help sometimes.
Right. Thank
So
you.
what
You're
I'd
welcome.
like to present, and that was a great question that I know we have a lot to talk about. So if you have any questions, please put them in the chat so we can make sure that we can get through Molly's presentation, then we'll take time at the end. Okay. Thank you, Molly. Go ahead, please.
Hormones. So this is where when we're thinking, particularly around menopause, but just hormone health in general, I think is just a undersung area of why we are feeling the way we are, both in our just tissues and in our mood. But when we're thinking about menopause, that means that we have a decrease in estrogen in the body. Estrogen does so many things, right? Irma, we talked about estrogen a lot in our presentation. But estrogen's really, its job is making your tissue like plump and pliable. And so that shows up in like, what is the skin doing, wrinkling, but that's also that's also true in that area of the pelvic floor. So that with menopause, we start to lose that estrogen in the tissue. And it's basically like tissue starts to get thinner, which I have a lot of clients who said, oh my God, I hit menopause and all of a sudden I was trying to have intercourse with my partner and it just felt like it just felt like sandpaper when they put anything in me. Like just, it really hurt and I was bleeding. Or, you know, any issues of like thinking about a pelvic organ prolapse or urinary dysfunction is because that estrogen isn't able to help support and inflate and give good blood flow to that, to those tissues of the vulva. We're also thinking with pelvic floor health about melatonin, because that's also changing during menopause. But it's it's not the kind of significant change as estrogen, but you know what, melatonin is like what keeps ourselves, it helps with sleep. And
So
again,
what's
talked
the
about
dosage? What's the dosage of melatonin that you're, is that something you make reference to, or just in general you're talking about?
this is an interesting thing, and one of the reasons that's like being a PT is a little annoying is we can't I can't tell anyone to take Tylenol legally, in my license. What I can say is like, here are things I've recommended that my mom does, or sort of things you can look into. But in terms of scope of practice, dosage wise, can't dose it. And again, it also varies from person to person. I mean, I have had my own journeys with melatonin and it depends, you know, it just depends. But so yeah, so I wish I could, I really wish I could. But then in terms of other hormones, we're thinking about cortisol, and that's our stress response, right? So if we're thinking of how are we getting sick all the time, right? Like, you know, let's say we fall, we have a hip fracture, we want to heal, but we're not helping. We're having an excess of cortisol because, you know, where everything is terrifying, because the world, let's be real, is terrifying. I think if you're not terrified, cool, tell me your secret. But that kind of stress impairs healing. So like, what do we do to like figure out how to manage cortisol? And again, these things are all playing around with our mood during menopause. That's why people are like, oh my God, I feel like I'm going crazy, I'm really angry at everyone, or not, right? All of these things change. And this really means the whole goal of this, and this is true of I think everything in our conversation tonight, is that we're thinking about what homeostasis is, that our body really likes balance, and it needs balance in terms of not too much, not too little. Like, we're basically Goldilocks forever. And it's always going to change of what that homeostasis is. Yeah, cool. We could talk about hormones all day. It's so interesting.
Cool.
And okay. And so I think this is something that I feel like is a very useful way to know that going to see a pelvic floor PT might be really useful for you, but it also explains a lot of like what is indicated when we're thinking about this region of our body. Like if you've had this hip growing pain, if there's been a fracture, if there's scars, pelvic organ prolapse. Prolapse is when an organ of the abdominal cavity starts to descend either through the vaginal canal, or there's also rectal prolapse where the rectum starts to protrude out through the anus.
What
These
is that, Molly?
what?
How common is that?
Because so part of my job is to do internal exams. I don't use a speculum, I use a glove, and a lot of lube and one finger, and do an internal assessment, both intravaginal and intrarectal. So I see a lot of vulvas. I see probably 95% of the clients that I have some degree of pelvic organ prolapse. What's tricky is a lot of gynecologists won't tell a patient they have a prolapse unless they're symptomatic. And so and prolapse can occur, again, not only with just the tissue changes associated with menopause, but childbirth. Again, prolapse is where we're having a mismanagement of pressure, where we're thinking about commonly the vagina, or sorry, not the vagina, the bladder, the small intestine, the uterus, the rectum start to descend, and you can see, and it goes in grades, right? So some people you'll just see a little bit at the back of when you're kind of looking, you spread the tissue and you see. Some people it'll be protruding all the way externally outside the vaginal canal or outside the anus. And symptoms kind of tend to be sort of a feeling of like heaviness, or aching, or like when you go to the bathroom, you have to like push something out of the way a little bit. And it's just super common. I think it's, there's a lot of, things I would like to do if I were to run for public office. And one of them would be to take down WebMD. And I find that most Google searches around prolapse, I find my clients come in absolutely terrified and feel lots of shame. And the reality is it's so common. It can be managed. Sometimes it's surgical intervention. Sometimes it's wearing something called a pessary. That's like a little, they come in all different shapes, but it's like a little object. So they can be cubes, they can be discs that get inserted into the vaginal canal and give some support to the abdomen. And then a lot of it is exercise. And a lot of it is figuring out like, how do we contract the muscles when we need to, so that, when we go to run or we go to jump, we're really giving some support to that abdominal cavity. But so common. It's so common.
What's the average age of your clientele, of your patients?
It depends on the day.
Mhm.
I feel like my youngest clients, right now, I don't have any young folks. I guess in general, I see people after they've had their first gynecological exam. Just pediatrics is, just development is different. And I just feel really strongly about thinking about medical trauma and being very protective and careful of, just guiding anyone's experiences. But I have seen some kids on occasion, but generally I feel like late teens to my patient. Right now I have somebody who's I think 89. But yeah, all ages, all genders, all different types of anatomy. And which is what I like, that because it's, there's so many different transitions that we go through in life, and they're all challenging and fun and exciting and hard and scary in different ways, but that's also the human experience. And so yeah, I mean, so I really like that wide ranging of age.
But one of the things that I always that I not I almost said I always appreciate about you, as if I've known you forever, but I feel like I have,
It's
is
been a
that,
while. Listen, it's been a big year, at least for me.
but also you're reducing the shame, eliminating the shame. And I remember Oprah Winfrey talking about down there, down there.
Yeah.
It's like, what the hell? It's a vagina. I mean, come on, let's give it a word.
Okay, but let's be real. Like we're talking about down there. You know where down there really is your toes. Like that's down there. Like the floor is down there. I mean, like I think that it's if, you know, these are muscles that are just they're just muscles. They just happen to be in a warm, dark place. And these are all functions of our body that, if you were the only person in the universe who happened to lose control of their bowels the one time they had really bad food poisoning, then I wouldn't have a job. Right? Like so I think, and I just think there's so much isolation and there's so much shame around these things, and that, but there are also things that like when they're going well, we don't talk about peeing. When we have stool that looks like a nice little tube of toothpaste and we're not having to push too hard and it's happening regularly, like nobody talks about it. Unless you're in, but whatever, unless you're in my family, but that's different. Although my mother is endlessly entertained by me. But and then in terms of sex, like, I mean, that's just a whole animal of, I feel like, so many people come in saying like, I don't know if this is normal, but like, I really like this thing or this thing hurts. And it's like, it's okay. It's your own body. Like, as long as you are not hurting someone else, feel free, have a great time.
There's
Because
also, there's also this thing about maybe we're letting go of our vagina as we get older. We don't think about it.
yeah, no, that's like, that should not be a thing. I mean,
Not be a thing. Right.
And by letting go of the vagina, do you mean in terms of appearance, sexual activity, health? What
All
do
of the above, all of the above, paying attention to it, looking at it, um, it- tending to it,
and I mean,
stimulating it.
my feeling about this is, okay, see if let's try to go with this analogy. See if you guys stay with me. Maybe it'll be too weird. I don't know. But so I love my parents. They're amazing. I'm an only child. And my parents are also only children. My mom was actually at the event that I met Irma at. Um, but my mother, they're both 76, and my mom retired at 75. And she had an incredible career. She was in the same office. I mean, she ran an organization from when I was born to now. So again, I'm 40. And this woman had so many retirement parties and was given so many awards and so many presents and so many accolades for her career. Great. Awesome. We've also been living in our bodies our whole lives. So I think we should get to celebrate them just as long. Like, I mean, we're not going to retire our bodies. That's when we die. And so I think that as we age, I mean, from my perspective, you know, we've had more practice by a certain age, we've had more practice with all these things. So I think we should get to do them more and celebrate them more, right? Like it's and let's talk about sex for a second, right? Like, I don't know when you guys started having sex, but after a certain point, I mean, think about how much practice we've had. Like, why on earth should you be letting go of your vagina when you're like a veteran of an activity? That's the way my brain thinks about it. And also, like, if you've gotten to retire, maybe you have a little bit more free time. You know what I'm saying? And I don't mean that just about, again, partnered sex. I think about that in terms of masturbation. And so, but yeah.
But I want to, we have so little time, which is very upsetting. But the whole idea about vaginal stimulation, I mean, how important is that to the overall function of the body?
Oh, that's a good question. I mean, in terms of just like general life function,
Getting the juices flowing.
it's super important. I mean, we want blood flow everywhere in our bodies. I mean, how many times in an exercise situation do we go like this, right? Because you want to get circulation in your fingers. You want circulation through your vaginal tissue, through your pelvic floor, again, because blood flow helps tissue stay healthy. One way to improve circulation is through stimulation, right? Is through sexual activity, is through self-touch. Because it does, like, orgasm, just feeling good, even if it's like a self massage, improves circulation, improves just and that improves our mood, that improves our energy level. So I just think it's not like just letting it go it's unnecessary and not helpful. And I think if it's in terms of an area of shame or about pain, whether that's if you're thinking about it from a sexual health context, like you don't have to just have sex with your vagina. I mean, I had a wonderful client who at some point, because I was asking about their sexual health, and they were like, well, we don't have intercourse anymore, but my partner holds my hand a lot. And that feels really sexy to me, and that works for me.
Right.
Like,
Exactly.
so, I do think, I mean, I think moving your whole body is really important. We know that, right? And this is just another part of your body. It's just should we call it mid there instead of down there?
Or,
Like,
or meet me there. But
yeah, yeah.
I want to share I want to share a fast story. When I was living in New York City, I was doing a, qigong class, and there was a Chinese teacher, and he actually had a sidebar teaching class, and he said, "Here's what happens in China. If a woman comes to a local doctor and says, I have a migraine, the doctor will say to her, this is what he said, here's your vibrator, go to room number 3 and have an orgasm because we want to move the chi. There wasn't like, oh, doctor, stop, that's so embarrassing. It was like, okay, right. Here I'm with my trainer. I'll lift weights because I'm building my muscles. So when
Mhm.
we think about moving whether or not it's the chi or the blood flow or whatever we want to say, it's an important aspect of living.
I think it is. And I think one of my favorite pieces of homework to give people is to say to have an orgasm every day. My
Every day.
caveat with that is like some people don't orgasm or they don't know if they are, but I do think having some type, yeah, if you could have an orgasm every day, do it. It's great. It's also kind of fun to try to do for like 2 weeks to see if you can give yourself that much time and just see what happens.
Mhm.
And I don't mean that to be partnered. I think a lot of times having some fun by yourself is more and even more important than what's happening with partnered activity. And it's relaxation, it's good for sleep, it's good for maintaining bladder and bowel control. There's really no downside.
There's no downside. So we only have a couple minutes left, believe it or not.
Oh, wow.
Vicky has been looking at the questions, but basically what you're saying is the pelvic area is so important from the balance point of view. And I just want to make sure that that point is really brought home because when we think about falling, we think, oh, we lost our balance. We don't think like, oh, my vagina's loose or, oh, I'm not doing Kegels. We just think that, oh, I'm falling. So can you say that again in a I don't mean to soundbite your work, but in a way that maybe we can understand that the pelvic floor is an important part of fall prevention.
It is. And I think it's what are we, we fall prevention. I mean, there's so many factors that go into balance. But that some of the major players in our balance when we're thinking about standing upright are the glutes, our quad muscles. These are all things that are attaching to your pelvis, right? So that falls under that 36 muscles. Um, but if you have a muscle group that is not working for you, whether it's too constricted and that's when we don't want to do the Kegel, or it's too lax because for whatever reason, and that muscle group is not working, then again, it's that group project. So someone's out to lunch. So somebody might have to be working too hard. Maybe it was the hip flexors and now they're super tight and they're not working right. And so you go to fall and you're falling forward and your glutes can't catch you because everything's bent too far forward. Was that
Right.
short?
Yeah.
I'm not known for being succinct. I'm known
Right.
for a lot of things, but not.
Okay. But we did touch upon Kegels, and that was the opening question from Michelle. So can you just wrap up with Kegels? Kegels are a, they're appropriate at certain times, certain kind of Kegels, or what's your thing?
Sometimes, I mean, it's basically so when I palpate internally someone's pelvic floor, what a Kegel is that we're contracting a full contraction of the pelvic floor. We're squeezing and we're lifting. So 5 out of 5 strength, the best strength you can have is that you're squeezing the practitioner's finger and you're pulling it, you're able to lift it. That's what a Kegel is, pull, lift. Doing a Kegel is helpful if your muscle is truly weak. And a muscle could be super restricted and still be weak because it can't go anywhere. It's not doing anything, but what it needs is to be lengthened. It needs to be massaged. It needs to be stretched. And then just because it's stretched doesn't mean it's strong yet. It then needs to go through that process of being able to learn how to strengthen. So when we think about, and so what tends to happen is that tissue can be something called hypomobile, not mobile enough.
Mhm.
And so so somebody needs to figure out is the reason that they're peeing when they sneeze that their pelvic floor is weak. Truly, those muscles are just not doing anything. They're out to lunch. And that's when we start doing the Kegels. Or are those muscles, let's say we lost a bunch of estrogen and, we're trying to hold everything in and we're gripping the pelvic floor and actually our muscles just got stuck up here. And that's when we don't want to do Kegels because we're not getting anywhere. That's when we want to do that reverse Kegel, that lengthening. And sometimes I find it's hard for people to know which one it is on their own. It depends. It really depends on the patient. And it's very interesting. And sometimes, it won't even hurt, and you're just like, oh, wait, but that muscle isn't doing what we need it to do. So it depends is the shortest answer.
And one of the things that's pretty important, what I'm hearing is that why not have a pelvic floor interview with a PT therapist that says, well, wait a minute, like maybe I'm doing Kegling wrong, or maybe I shouldn't be doing Kegling, but because we don't know. If we're talking about down there and we don't even know that we're doing the
Yeah.
Kegel, right? That
And
makes
and there's just, it's like you can, and it's having that conversation with your pelvic floor PT, and then are you, having good conversations with gynecologists, or primary care providers of, do you want to do hormone replacement therapy, or do you want to do topical hormones? Like really thinking of like giving yourself the gift of, treating yourself like your own best friend, right? And that giving yourself a gift of like, yeah, self-exploration, and making sure, like, getting the most out of life and getting the most out of your body.
no.
And also pelvic floor therapists, I think, do have additional training because we have this ability to do internal manual therapy because we've taken lots and lots of classes. And I think sometimes that give that being able to do internal work, which doesn't always happen, depends on the client, can help sort of understand what's happening with those muscles of the glutes and everything just a little differently.
All right, thank you. So we're at the top of the hour. If you have to go, I understand. Vicky's going to roll through some questions, and Vicky, do you want to take charge of here? But thank you, everybody who's been here, and please stay if you
Thank
can.
you so much. I'm so, for those of you who have to leave, I'm so happy that you reached out. And actually here, I'll go through, there's my contact information.
Thank you.
Good.
Let's leave that up there, and
Yeah.
then Vicky will ask the questions.
Sure. So there's a couple of parts to this. What is your opinion on the Mona Lisa laser treatment for vaginal dryness and urogenital problems?
I love interdisciplinary care. I love interdisciplinary care. I think it's awesome. And I really like modalities, like things like red light. In terms of the Mona Lisa, I like the Mona Lisa. There's something called Morpheus 8, which is sort of like a microneedling radio frequency treatment. It's friends with Mona Lisa. I think it's less common. And I find that in terms of vaginal dryness can get deeper tissue, get sort of deeper into the tissues. And so I think has slightly better results. But so I like the Mona Lisa. If, again, it's like, what would I tell my mom to do? I would say do the Morpheus 8. I personally do the Morpheus 8 for myself. I don't do it myself. I go to my gynecologist for it. And I find it's really, really good for both vaginal dryness and pelvic pain, or any pain with sexual intercourse. I think it's really useful. And it's also actually just plain old appearance of the vulva. It sort of makes things look a little fluffier. I don't know how else to describe it, but
So does healing and strengthening the soft tissue help strengthen the pelvic floor?
say that again.
The question was, does healing and strengthening the soft tissue help strengthen the pelvic floor?
Oh, for sure. For sure.
Okay.
And Vicky, before you go on to the next question, if you do have to leave, if you can put in the comment, what was the one thing that you took away from the conversation, that will be very helpful for Molly. So go ahead, Vic.
Yeah, and do vaginal weights help strengthen the pelvic floor?
It's so funny. I haven't the kind of I've never actually used them with a client. If only just I feel like it would be very easy to be using the wrong muscles to do them.
Mhm.
But I think having tactile cueing in for strengthening tends to be really helpful, even if that's a finger. There's something called a pelvic wand, but like feeling like, okay, yeah, like I'm holding on to something and I'm pulling it in. And but I actually have not used, and actually none of my colleagues have used the vaginal weights with clients. It just
Okay.
That's a good
Yeah, but
question.
someone who gets anal spasms,
Ah.
that she wants to know, is it connected to the pelvic floor and what can you do to prevent it?
For sure. So when you're thinking about your pelvis, I'm so sorry I don't have a pelvis in my house, but I mean I have mine and my boyfriend's and my dog's, but a pelvic model. But when you're thinking about your pelvis, you're thinking about that pelvic bowl. So right, so you've got your pelvis, pelvic bowl here. Those muscles line the entire pelvic bowl, including around the anus. And and those muscles, a good example is a muscle called the puborectalis. If you've seen have any of you seen ads for the squatty potty? The puborectalis is the muscle that they're talking about.
Right.
And so for the puborectalis I love language. Remember, I'm a big book nerd. It's named for pubo, attaching to the pubic bone in the front, and then rectalis wrapping around the rectum. So you can improve with doing pelvic floor work of any type when you're never just working on one hole or the other. You're really working on the whole system of that whole hammock inside that pelvis. And in terms of preventing it, some of that is thinking of like, thinking about diet, right? Or what are the quality of bowel movements? Are you having to push a lot? Thinking about what your pelvis is doing in space. Are you tilted? Are you really sticking your butt out like Daffy or Donald Duck, or are you curling under? What's your tissue doing? Again, is there something going on physiologically with the hormones? So there's, and also sometimes with a muscle spasm like that, really, again, going back to that, thinking about just kind of seeing like what happens if you take a really nice breath and take a moment, and sort of check in of like, okay, that hurt. Whoa. All right. Breathe. Although that's not a great answer. Or come see me. You can prevent it by coming to see me too.
Can you suggest any programs to learn proper breathing, especially if you have mild COPD?
Oh, that's a very good question. I think if I was to be like, okay, I would like a good program, like a virtual, I don't know of one off the top of my head. If I can think of one or find one, I'll message it to Irma. There are some, there's like a couple of different like types of breathing drills and stuff that I like a lot, but that's sort of one-offs in terms of like one app or another. I'll look into it a little bit more, but I don't know a good one off it. But that's a great question. That gives me some homework, so appreciate it.
Okay. I'm not quite sure this is a sort of combined question, but it has to do with an unrepaired umbilical hernia. And they're going to be having a spinal fusion, an L4, L5, and I'm not sure what the two mean together. Anne-Marie, if you want to say something.
Yeah.
I wasn't muted. Hey, Anne-Marie here. Thank you so much. This is such an amazing call. And now I have a great prescription for my back-to-back migraine headaches.
Oh yeah. And also some lymphatic drainage. I think you should do some masturbation and lymphatic drainage, which also, yeah. Anyway, so tell me about what's happening.
So much better than going to the doctor for the headache. Oh my goodness.
And I took a course that just talked about headaches. It was fascinating. Anyway, all right. So
yeah. So basically I have the spondylolisthesis of L4-5. So I've tried all sorts of things and it's, I'm going to go forward with that. But I have had an umbilical hernia for 40 years since I delivered twins, but it has been like, there are a couple of times a month where it's feeling, it's more difficult to reduce it. So, I saw a surgeon and he said, you should probably get it fixed. My concern is, I've wondered, is it better to get it fixed before the spine surgery? Does it really matter?
I don't before after the spine surgery. I could see pros or cons to doing it in either time frame. I think have you tried doing any PT for it or like core stability stuff?
For which thing?
For the hernia, or actually either one?
A little bit for the hernia, but I have so much discomfort from the spine issue with numbness and pain in my legs. Yeah, it just wasn't worth it. Wasn't worth it.
Yeah. Do you do any like abdominal binders or any like compression support for yourself? Have you tried that?
No, I've never done that.
Okay, that might be one thing to do just to give your support to support both basically kind of helping the abdominal wall get a little bit of assist from that hernia. But yeah, in terms of the order of which one to repair, they both, there's just pros and cons in terms of like healing time for like what positions do you have to be in and movement restrictions and stuff like that. So I would ask, yeah, I would ask the surgeon or ask your physician of like which one makes sense. But I would do a bunch of PT regardless of what you do, which one you do when.
Mhm. You mean after or after the surgeries?
Yeah, after, and even in doing any of it before, even like
Mhm.
someone help you, just really like working on like having some good strength for your upper quarter. So take that, Oprah. But sort of kind of like I think of like your upper back and your shoulders, of like how making sure that like you have this fusion, right? So we're gonna have a little bit less mobility through the low back. So making sure that the upper back strength wise like feels like it can help out in the same way too. So and like
So, yeah, so building up her body, you're
building,
saying?
building all over, getting as
Mhm.
strong as you can. Just in even because there's like thinking about the what you're describing, the nerve symptoms and stuff of like, really like getting ready to like get your glutes nice and strong again and stuff. So
Mhm. Thank you so much. This is an amazing call and a phone call too.
dogs
Thank
were
you.
quiet, which is impressive. I think my boyfriend chained them up upstairs.
This has been really great. Thank you, Irma and Dr. Bowman.
What do you know on the use of the Emsella chair for pelvic floor treatment of incontinence?
I know that that's something that people send me TikTok videos of on a
Okay.
regular basis. I haven't gotten to sit in one. From what I've looked at, it looks sort of like sitting on the washing machine to me. But uh, that's fine. Nobody's been able to sell it to me in a way that I was like, cool, other than that it was a gimmick. But the one gadget, this is not about the one gadget that I am kind of intrigued right now is by vibration plates, both from a balance perspective and a lymphatic health perspective. Those are the ones that have my attention the most in terms of sort of segued in terms of videos that people send me randomly and questions about. But yeah.
The
And
lot.
what was that called for the lymphatic?
A vibration plate. There's a bunch of different ones on the market. I haven't I've been trying to convince our clinic director that we can buy one, or I wimped out on Amazon Prime Day on getting one for myself to try it, but so I'll report back. They look cool.
Anything else, Vicky? Vicky, you're on mute.
Well, the dogs were barking, so I muted myself.
Oh, all dogs though are welcome.
Most of them are sort of just comments.
Well, Margaret was talking about, you see Margaret at the end, replens.
The
As
Replens as a vaginal moisturizer. Yeah, because she can't use estradiol.
Yeah. I
Is
like,
that safe to use long term?
yes, absolutely. I mean, okay, labia minora and majora, the outer lips of the vagina, labia's lip. We put moisturizer on these lips all day long, right? The
Mhm.
same
Mm-hmm.
type of tissue, of skin tissue. And so I just think about what can we do again when we were talking about like letting the vagina go to like nurture and love this area of the body. So, no estradiol. Replens is great. There's, you can use coconut oil.
Mm-hmm.
There's a product that I like a lot called V Magic that's sort of almost like beeswax, I guess. But really moist, again, we moisturize our skin, moisturize our face, moisturize these lips. Why would we not moisturize the vagina? Really needs it. That can help a lot with pelvic pain, and also pain with any type of intercourse. The other component about that moisture is also really thinking about using lubricants when it comes to sexual activity. Not in addition to wanting a vibration plate, I really would like a tank top that said more lube. And I think particularly as we age, there's some idea that lube is like meaning there's something wrong. And I just think lube is like part of the party. And, you know, really thinking about good, like the ones in the drugstore are garbage. Most of them actually have preservatives that negatively affect the vaginal lining, the pH of the vaginal lining, causing things to have more micro tears and more friction. And so things hurt more, which is,
Ooh.
but there's, in terms of like quick off the top of my head, there's a lube that's by a company called Maud. And I don't get any money for any of these things. It's just, these are the ones that I've kind of found. But there's one by Maud that's called Shine. And then I also really like the use of CBD for vaginal tissue health.
What?
Yeah,
Really?
it's great. It's
Wow.
great. And there's actually a physician that I'm supposed to have coffee with who's doing THC suppositories with a lot of his clients. And actually, I'm a breast cancer survivor, and sort of some of my breast cancer friends have sort of experimented with creating THC suppositories to use internally vaginally. But in terms of CBD, which is much more accessible, basically CBD also increases blood flow and decreases pain. So it increases sensation, and also increases circulation. I think it's awesome. I wish I could just walk around. I wish I could reach through the computer and hand all of you some, there's a company called Foria, Foria, that makes sexual health products. And then there's a company called Estrella, which is, I can, Astraea, and I can give this to Irma to email out if you want after. And Estrella is really cute. They're for us New Jersey folks. It's a husband and wife duo in northern New Jersey, and they just had a really cute baby. And the CEO, she likes her mom as much as I like my mom. So a lot of our collaborative calls are us talking about what our moms are up to. But I think, and it's great for all parties involved. Like both partners really tend to really like it. And yeah, I think CBD is great. Fabulous.
So, the one question is topical CBD, and you're saying yes.
A+. I give it 5 thumbs up.
5 thumbs up.
Topical, both you can use it via suppository. And if you're thinking about intimacy, you can use it that way. Also just plain old pain when we were thinking about those anal spasms, using CBD as a suppository can be.
I wanted to share one thing about those of us that have suffered with constipation for years, and that's me. For years, I always thought that I had to push, I had to strain. Until I went to a pelvic floor specialist that said, no, it's about the exhale. It's about the releasing. It's not pushing, it's exhaling as you're sitting on the toilet, allowing it to open up. And it's like, wow.
Yeah, constipation, water, hot water with lemon in the morning, the Jewish old lady trick, it works. My grandmother was onto something. And really just taking a big breath in through your nose, thinking belly big, and exhaling belly bigger, and letting things really be soft. And fiber, really looking at what, gut health is real, and that I like, again, kind of thinking back to that puborectalis thing. I really like thinking about language, and seeing where these ideas of these functions show up in our bodies, right? So, someone's full of shit, or they're anal retentive, or, and thinking of like, okay, you're stuck. That person is like kind of uptight, right? So like that person needs to relax. Oh, look, we need to relax the bowels to not be constipated, so it's just, I think that kind of stuff is sort of fun to play around with, like somebody's pissed off, and I don't know, I just think it's kind of interesting.
So before we close, and we didn't talk about this, and this is another whole topic, but do you recommend any sexual toys or a vibrator?
Yes, more of them, always. Again, it's kind of like sexual health toys in terms of like lube. It's like, it's not replacing a partner. It's not because something's wrong. It's just fun. They're called toys. Toys are inherently, in theory, fun. End of story. There's a lot of different types of toys, and that's thinking about, and this is a whole other topic of different types of orgasm, but there are different types of toys depending on what feels good to you. I think if you were going to just be like, okay, I'm going to get off this call and I want to make an impulse purchase, I would say there's something called Lawand,
How do you
which
spell it?
LE
Mhm.
space WAND.
Okay.
And I like it partially because it looks like a Barbie microphone. Um, partially because it plugs into the wall, so you don't have to worry about batteries. And it also, you can get attachments for it if you want it to be internal, but it has a lot of varying degrees of pressure. So if you want just a little bit of pressure, a little bit of sensation, you can have a little bit of sensation. If you need like a lot of pressure, because again, we're thinking about what happens with hormones, sometimes sensations decreased a little bit. That one. I really like Lawand. And I really like one, what's it called? The Satisfier. And the other thing about sex toys is thinking about where you buy them, right? Like you don't, we all know that like organic vegetables are the way to go. Like there's a lot of sex toys that are made out of mystery meat, like the random ones on the internet. The website there's a couple websites I like a lot. There's one called Wildflower Sex. And it's a female owned company. I think they're in New York. But they're just all body safe. They have some pretty good educational tools just about, and and they have things where like you look at it and you're like, where do you put that? Like I don't really know.
Right.
But they're also divided. Like if you know that you like clitoral stimulation, they have toys that are just for clitoral stimulation. There's one that's really cute, looks like a little rose. I mean, it's just like fun. It's a toy. Like it's not called like a serious sexual device because there's something wrong with you. It is called toy.
Right.
It's just something else to add into the mix.
Thank you. I mean, that was just a really good point as far as the organic vegetables, because Lalo is also another product line that was recommended in
Yeah.
in Doctor's
I Yeah,
office.
I like Lalo, and I like Wildflower Sex has some Lalo devices too, or like Lalo toys. I like those a lot. I mean, they're all fun.
I don't know what they're made of, so that was an interesting next level of investigation as far as
Yeah,
Lalo.
and I kind of like the Wildflower Sex site because I know it's all body safe, right? So it's like you can kind of skip that part, and yeah, I really yeah, it's a nice resource.
You've been swell. Just really, just a delicious, delicious ingredient. And
Oh, that's such a nice compliment. Thank you.
yeah, thank you. Thank you so much. Because you made you made down there fun, is all I could
It's
say.
not, it's mid there.
Mid there. That's right. Down there is toy.
I've never thought about that, but that down there thing, it's just like incorrect
It
direct.
it is absolutely incorrect.
Like it's just like it's like you're passing a turn. I don't know. Yeah, I don't know if any of you are fans of have you watched The Office, the TV show at all? There's an episode where they end up driving into a lake because they follow the GPS.
Haven't we all?
Oh God.
I love Maureen's comment. She's like, "Thank you, one and all. Meet you there."
Yes, so good. So good.
And Lucilla wants you to come back, please.
I'm happy to come back. And you can always, I mean, this is my contact information. You can always reach out to me.
You don't do consultations over the phone. Of course, you can't do exams over the phone, but do you do consultations over the phone?
I can, depending on the state. Yeah, I can do them over the phone. I can't do, um, and I can do like an educational session and stuff over the phone. I can't, I do wish I could do, I just, with COVID and things, we did try to do some virtual PT stuff. And I think a lot of times I get encouraged to do things online. And I just feel like I'm not giving people what they need. Like I'm very tactile. You can see I talked with my hands, but I just think we deserve touch in that way.
We absolutely deserve touch. And that's a beautiful thing about PTs. And we have an extraordinary PT on the call who's Tracy. Tracy's here. I'm so glad you're here, Tracy. Did you have any questions that you wanted to ask, Molly? Tracy? There you are. Did you have anything that you wanted to ask?
I didn't, but it was a really fabulous, fabulous presentation. It was great.
Oh, I'm so
And
glad.
I knew that you were an awesome person, but now I really know you are.
Oh, thank you. That's so nice of you. I'm so honored you came. Thank you so much.
So Tracy is soon to create the Onero program. That's something that you and I talked about, Molly.
Yeah. Yeah.
Uh, Tracy's moving forward with that, and it will happen sometime in August, and that's going to be in Washington Crossing area for those of us that are close by in Pennsylvania.
Then
Uh,
let's have coffee or a phone call or something, because we're so close to you, so.
you and Tracy? Or
Yeah.
Oh.
Well, all of us, you could come too if you'd like to. In terms, I would love to be able to send clients to you for Onero work, so yeah, we'll discuss.
We'll talk.
Thank you. And I think I'd like to see you myself.
Oh, please do. We do something in our office called Heal the Healers, which is a program that's 5
Wonderful.
sessions for health and wellness people. Just
Hmm.
like you got to take care of people who are taking care of other people. So, and it's also just
Absolutely.
what other clinicians are doing. So, but yeah, come visit me.
So here's something, even as a retired nurse, it's always helpful to understand, remember that our body is composed of many different parts, and they are interdependent and interdependent. That's repeating. By the way, I did classes on Zoom during COVID with Becky Keller. This was before she joined Active Core. Please tell her Lindsay said hello. Do you know that name?
I will absolutely tell her that you said hello. Yeah, I work with Becky. She works in my office as well. So
Wonderful.
yeah.
So great program. People love you. Yeah, fascinating. I like the pelvic health encompasses so many different aspects of our lives. Hope you come back. All right. All right, Molly. Night
Okay.
night. Thank you
Have a
very
good
much.
night, everyone.
All right. Bye-bye for now.
Bye.
Everyone,
Thank you so
thank
much.
you.